In June 1667, the first human blood transfusion was administered by Jean-Baptiste Denis. Denis was accused of murder because the person who received the transfusion died. William Harry discovered in 1628 that blood circulates in the body, and Christopher Wren invented the syringe in 1659. Withdrawal of blood, known as bloodletting, was one of the commonest medical practices to cure or prevent illness. Leeches or razors were used to draw blood. Bloodletting was not done by physicians but by barbers, who were called barber surgeons. During those times, physicians considered performing of surgery to be below their dignity. A 15-year-old boy was suffering from uncontrollable fevers for 2 months. A barber surgeon performed bloodletting by leeches 20 times to no effect. With the assistance of Paul Emerge, Jean-Baptiste Denis transfused about 12 ounces of lamb blood into the veins of the boy. Apparently, the boy's condition improved the next morning. With this success, Denis became bold and performed a few more such transfusions. However, while performing a third transfusion of calf blood into a notorious man of Paris in November 1667, the patient started to shake violently. The transfusion had to be stopped. The patient died the next day. A court case was filed by the patient's wife accusing Denis of murder. After some hearings, the court cleared Denis. The court also banned blood transfusions. Soon thereafter, the French Parliament, the Catholic Church, and the Royal Society also declared ban on blood transfusions. For almost 200 years, blood transfusion ceased to be a part of medical practice. James Blundell, an obstetrician and surgeon in London, revisited blood transfusion as a treatment option. However, he decided not to use animal blood but to use human blood for transfusion to humans. Blundell's procedure of transfusion was to collect blood of a donor in a cup and then to quickly infuse it into the recipient's vein by using a syringe. After a series of failed transfusions, in December 1828, Blundell carried out an unquestionably successful blood transfusion on a woman. A physician who was present during the transfusion was the donor. Thank you for listening. Now, some word power. Transfusion, TRANSFUSION, transfusion means it is a process of simple addition of one substance to another. Infusion, Blundel's procedure of transfusion was to collect blood of a donor in a cup and then to quickly infuse it into the recipient's vein by using a syringe. Infusion means a procedure in which whole blood or parts of blood are put into a patient's bloodstream through a vein. Thanks for listening.